All right. Can everyone hear me? All right. Welcome everybody out there in social media land. I am Dr. Kent Key, and we are the Flint Public Health Youth Academy. Thank you for joining us for another episode of A Youth Perspective. This week's show is a very special show for us. Our young people, last November, you may recall, they presented at the American Public Health Association in Boston, Massachusetts. And during that national medical presentation, we had some leadership from the National Amputee Coalition that came up to us and wanted us to partner with them. They service the largest number of limb loss youth in the country. And these are young people that may be missing limbs, whether they're legs or arms, hands or feet or fingers. And these are young people who are doing awesome things, and they wanted to partner with us. And so we partnered, and we're here in Chicago right now with these young, wonderful young people. And we'll talk to some of their leadership shortly. And we'll talk about what we're doing here, what we will be doing in July with them. And there's just an awesome opportunity to continue to provide early engagement to careers in public health and just understanding what public health is, going into medicine and also research. So we are excited. We're excited that they wanted to partner with us and that our paths crossed, because just like other marginalized groups, whether it's racial or gender or socioeconomics, limb loss population or the disability population is also a marginalized population that does not always have a seat at the table. And so we're just so excited that these doors of partnership has been open to us, and we're excited to explore that. Before we get going into those conversations, we just want to pause and allow our interns to greet you all. You know, just come off your mute and say something to the people, greet them, tell them whatever you want to tell them. We had a wonderful drive down through the snow in Michigan. And once we got out of Michigan, there literally was no snow on the ground. So we were just so excited about that. So we're gonna I'm gonna just pop it over. I'm gonna go to Asia and Joseph first because they're actually in the same room that I'm in. We're like all spread it across the conference center and the hotel so that we all can actually be in the video. So that's why we're not in one room, because you wouldn't really get to see us. So I'm gonna pop it over to Asia. Go ahead and use your inside voice because you're gonna be over here, and then go ahead and greet the people.
Hi, my name is Asia. I am a second-year student at Oakland University, but right now I'm in a gap year, so I'm really like a first and a half year student at Oakland University. I'm studying accounting, but everything has something to do with public health, so that's why I'm in fire.
And Joseph, use your outside voice.
Hi, I'm Joseph. I am a junior at Grand Blanc High School, and I'm excited for tomorrow. It should be fun. Yeah.
All right, Taishay, I see you.
Hi, my name is Taishay Brady. I am, I guess, a returning student at my community college going into sign language interpretation.
Everett?
Hello, everybody. I am a senior at Flint Southwestern, also dual enrolled at my community college. And I am one of the youth that is in Chicago, and I'm very excited to meet with and to learn from, learn the perspectives of these youth and, just make a connection with them.
All right, Tomas, I see you.
Hey everyone, hope all is well. My name is Tomas Stale, and I'm a senior, super senior at Genesee Early College with the University of Michigan Flint. And I'm happy to be here with you all today. There's a lot of faces I haven't seen in a minute, so it's great as always to see you. And I look forward to this conversation today.
All right, we got the Mays clan. And that's Melissa, Chris, and Cole.
All right, who wants to go first? Okay, my name is Cole Mays. I just graduated. I am currently going to attend U of M, University of Michigan, hopefully this summer. I have been in FIA for around 2 years. 2 years? Yeah, 2 years.
Hi, I'm Christian Mays, middle child here. I am at Mott for automotive engineering. I'm excited to be in Chicago. It's great. And I'm excited to meet everybody.
All right, thank you. And then I see Cruz.
Hi, I'm Cruz Duhart, graduating senior English major at Morehouse College. Yeah, I'm excited.
And you just have to show off that you're outside with the nice fresh air and the wind, gently moving the hair and the birds chirping. We love it.
It's a nice day, you know.
It's
wonderful. Spring break, I had to, you know.
Your spring is springing. All right, then I see we have Sima.
I can't see myself, but hi, I'm Seema. I am in my sophomore year at Genesee Early College. I am trying to, for my first spring class and college class. I don't know what I want to do, but I want to do something in art. So for GCI, I am going to be studying anything in like digital art or anything to try and become a tattoo artist.
Oh, cool. All right, Melody. Drop the mic, Melody.
Hi, everyone. I'm Melody. I go to Genesee Early College with Tomas and Seema, and I'm currently, I'm kind of undecided on my major, but yeah.
All right, then we got two awesome mentors. We got Jasmine Hall and then Dr. Monisha Summers. Go ahead and greet the people in that order.
Hello, I'm Jasmine Hall. I am an epidemiologist and one of the mentors for FIRE.
And a future doctor, right? I'm trying to encourage her to go get their PhD.
DRPH.
DRPH, that's right. That's right. Because that's the DRPH is a difference. Then the PhD is more research. DRPH is more practice, public health practice. Thank you, Jasmine. And then we have Dr. Summers. I know she said she was at an event, so she may or may not be able to come off mute at this time. All right, so what we want to do is we want to pause. We want you to get your phones and your devices out, go to our Facebook page and like and share right now. Everybody, let's do that.
But last but certainly not least, we got to announce the one and only Briante.
Thank you, Tomas. Hello, my name is Briante Brown. I'm assistant GIS analyst at Michigan State University and a mentor as well.
Briante, how did I miss you? I think it's because you was throwing shade on my driving.
It had to be that because I was like, wow.
And it wasn't intentional because we've been talking. So in my mind, because it's so weird, I looked over at Adrian and said, did I call Everett? She's like, yeah. So I'm asking, making sure I didn't leave out anybody. I'm so sorry. I owe you lunch, sir. All right. And then we have Kiara. Kiara, go ahead and greet the people. We're just doing greetings right now.
Okay, I'm out. Y'all can hear me?
Yes.
Okay, I'm gonna be turning on my video in just a second, but I am Kiara Wallace. I have been a mentor, I think, for 2 years now. I am originally from Flint, and I am a third year University of Maryland School of Law.
So as you can see, y'all, we have such an awesome group in the Flint Public Health Youth Academy of interns with such a variety of interests and disciplines. We have awesome mentors, from law and medicine. You name it. We have some awesome individuals. And we're just so excited that the work that we've been doing for this last, 3, 4, 5, 6, 7 years, we just keep counting, has really been building and expanding as we really work hard to provide a platform, one, for youth voice to be heard, and second, we provide a platform for early exposure to public health and public health careers. So we're just excited about the work that we've been doing. So for those of you who've been following us in social media land, we've been doing a lot of health messaging campaigns, right? We started earlier in like, I think 2018, looking at parks and recreational spaces to see if they were conducive for young people to have engage in physical activity. We did some policy recommendations there. Right after that was COVID. We went right into health messages campaigns around COVID that were by youth, developed by youth, disseminated by youth, and really put in places where youth utilize social media. After that, we went into some campaigns specifically around mental health, because we realized that during the quarantine, a lot of our young people across the country were dealing with a lot of mental health from social isolation and so many other things. You know, we realized young people were trapped in the home with the actual abuser, like going to school was the only time they could get away. And so it was so many different things that we did in those particular health campaigns. And then we also did racism as a public health crisis. We did racism dialogues with young people to kind of get their understanding of racism and its impact on mental health. And then last year we did an environmental health campaign. We looked at what was going on in Flint, Michigan with the Ajax Asphalt Company, you know, which is already compounding with the still ongoing water crisis that people don't know is still happening. And so we've been doing a lot of work, and we've had our summer camps every year. Even in COVID, we had them. You know, we had physical distancing and masks and all of that. And so our young people did such an awesome job that we submitted and actually shared this work during the American Public Health Conference this past year in Boston. And that's where we came into contact with a young lady that was from the National Amputee Coalition. And she invited us to do some partnering with them. And so today we're in Chicago because one of the events for the coalition and for the young people that are part of their programming is their Youth Empowerment Luncheon on tomorrow. And we will be presenting public health and some activities to the young people to really get them thinking about public health and their voice, their needed voice at the table of public health. So we're so excited to have Jerica Thurman, who is the Chief Strategy and Communications Officer for the Amputee Coalition, with us. She is our guest, and we're going to kind of get into some conversations. We're going to just ask her first to tell us who she is, what she does, what the organization does, what we're planning on doing today, whatever else she wants to tell us, and then we'll get into some conversations looking at public health, youth, and COVID, because we're still dealing with it, and what is it like for limb loss youth living through COVID, and then also with the whole trend of mass shootings happening across the country. She'll share some perspective with us. What does that mean for limb loss youth, and what do policy and decision makers need to consider when creating different types of emergency plans? So without further ado, Jerica, tell us something about you and greet the people.
Thank you. Good afternoon. I'm glad to be with you today. I'm very excited to be in Chicago. I am originally from the Washington, D.C. area where the Amputee Coalition is headquartered. And so I am happy to be in this area to celebrate the Amputee Coalition's inaugural Youth Empowerment Luncheon. And so before I get into the details of what the luncheon will provide, I would like to take some time to give you some background on what the Amputee Coalition does and our mission. I have enjoyed my year and a half working with the Amputee Coalition as the Chief Strategy and Communications Officer. And I've seen a lot, and am happy to be part of something great that's going on at the Amputee Coalition. We are the leading voice on limb loss and limb difference, and we are the only national nonprofit that serves all individuals who experience limb loss or limb difference. We are dedicated to ensuring that no one faces limb loss alone, and our mission is to support, educate, and advocate for people impacted by limb loss and limb difference. Our vision is to create a world where our community thrives. We work to provide vital resources to people with limb loss and limb difference, as well as their families and caregivers. And with these resources, they can recover, readjust, and live the life they most want to live. The interesting thing about limb loss is it can happen to anyone. Limb loss, what we find is result of sometimes born that way, but the majority of it is due to tragic incidents. So many people living with limb loss, they know life just like you and I. And then when they have this traumatic experience, they have to learn how to live life over again now in this new condition. And so that's the beautiful thing about the Amputee Coalition. We create a warm and welcoming community for those individuals. Awesome. We help them understand that they're not on this journey alone. And so there are three key tenets that the Amputee Coalition promotes. And again, that is no amputee is alone. We help to ensure that anyone living with limb loss is not alone and understands how to make it through what we call the pre and post amputation and recovery. And that is a critical piece. Many people, you know, I want to say their future is determined on how they begin that journey. And so being there with them, holding their hand, encouraging them, helping them believe that they can, you know, become whole again, is important for them getting to a point where they're thriving, living with limb loss or limb difference. The other areas are just, again, the fact that limb loss is not uncommon. It is becoming less uncommon every day. Again, it could happen to you or me. And so, and then the other key tenet is understanding that life is not over. I mean, you can still live life well with limb loss. And so those are three areas that the Amputee Coalition really messages out so people can understand that they can still live the life they want to live, even with limb loss or limb difference.
Yeah. I mean, I think, first of all, that's awesome just to think about the fact that, you know, most people don't think about it unless they have someone in the family that has an amputation. I know in the African-American community, a lot of times, you know, our elders may become diabetic or they may have to have an amputation. But just the fact that this is a resource that a lot of people may or may not even have ever heard of unless they have that.
Right. And so I actually want to echo what you're saying, because that is what attracted me to the Amputee Coalition. I actually had an uncle, so someone in my family who suffered from diabetes and was amputated on both his legs. Wow. And so it did take, you know, a lot of family support to provide for him and to care for him. And as I stated, that is a good indicator that, you know, limb loss really could happen to anyone depending on a variety of conditions. And so in this case, diabetes and vascular disease is a very common cause, particularly for people of color, and that leads to limb loss. And so part of the Amputee Coalition's mission is to create greater awareness and to partner with organizations that addresses those issues, to first help prevent limb loss, but also to provide, again, you know, the next step and home for people who wind up in that condition, so they know that there's still good resources. And also, in addition to resources, I think the other thing is understanding when you enter into the disability community, that you have rights.
Yes.
And so that's another part of what the Amputee Coalition does. And so we are adamant about advocating and raising awareness about limb loss and limb difference. We advocate for equal access to medical treatment, insurance coverage, and care. And one particular policy of legislation that we promote is the AAA Study Act, which helps to identify best care practices for amputees. And so I want to go back a little and say that since 1986, the Amputee Coalition has been focusing on empowerment for people with limb loss and limb difference. And I think that's critical because anyone who has a health condition, sometimes we feel like we're kind of being told what to do. And that's because sometimes we don't know anything different. And so one of the key things that the Amputee Coalition provides is the National Limb Loss Resource Center that has a plethora of resources on helping people to understand, first of all, their condition, understanding, what their possibilities are living that condition, and what their medical care should look like, right? So essentially, when we talk about health equity and again, equal access to care coverage, and it's particularly insurance coverage. I mean, when you're new to this community, to this condition, you don't know all that off the bat. So that is one key thing that the Amputee Coalition focuses on, in creating those kind of resources and publications. We partner with hospitals. So shortly after someone experiences an amputation surgery, they actually are given a packet that says, "Welcome to the Amputee Coalition."
Wow.
Yeah, and here's all your resources, and here are the things you need to know. And so we are able to provide the Natural Limb Loss Resource Center in partnership with the Administration for Community Living through the U.S. Department of Health and Human Resources.
So that's just awesome, like just to hear that once someone experienced amputation for the first time, it's like this welcoming into like this new community for them, and that embracing, like, we need the village, right?
Exactly.
If we're going to be successful. One of the things I want you to kind of define for us, just in your own words, because we normally have between like 2K to like, I think the highest we've had is like 8K views per show. And one of the things is the term limb loss or limb difference. People may not totally get what that means. So can you share what that is?
So limb loss is having either a body part, your arm, your legs actually removed, right? And then limb difference is kind of like Nemo, when you have a shorter type of leg. Yeah, and oftentimes that is more a birth defect or something that happens at birth. Whereas limb loss actually can be due to, external factors not related to birth.
And so does limb loss also include like a finger?
It does.
Okay.
Digital, your finger, your toes.
Okay.
So there are many notable people who live with limb loss. And as you're talking about, your toes, I think everyone knows Deion Sanders. And so there are notable people who have a variation of limb loss. And so, yes, all of that is included in our community.
All right, that's awesome. And so again, this is just another platform where we educate a broader community, one, about the Amputee Coalition, and also defining what does limb loss or limb difference mean. So we have some other special guests that are coming in the room from the coalition. So we'll be passing my laptop around. I couldn't figure out how to get us all on one big screen. So we're doing, I think, 2 podcasts at the same time. So this is awesome. What are we expecting to do on tomorrow? What is tomorrow all about?
So I have to say, I'm so thrilled to be here to celebrate with our youth engagement program team, our inaugural, again, Youth Empowerment Luncheon. I want to say that the Amputee Coalition, again, since 1986, has been supporting people with limb loss and limb difference. And for several years, we've hosted an annual youth camp. And so that is our outreach targeting, young people living with limb loss and limb difference. And so that has been successful through the years. However, just recently, through the vision of Dr. Alicia Strouder, who's our Vice President of Human Resources, Diversity, and Inclusion, and for the Youth Engagement Program, we have recently established a year-round program, and this is what we're calling now the Amputee Coalition's Youth Engagement Program, YEP. And so I'm just so pleased to have the privilege to amplify the voices of young people living with limb loss and limb difference. What we say is that amputee youth voices matter. And so in this case, this allows them to come to an event starting today and tomorrow that will, again, focus on empowerment and also nurture leadership. And I think that is critical because, you know, one of the beautiful things about amputee youth is they are very strong and resilient, and they have to be. They have to face and endure unusual challenges that the average person does not.
Absolutely.
Whether it's self-acceptance, inclusion in the schools, overcoming stigmas. And so they are already prepared to be, have strong character and to lead and to shape change for the future. So we're excited to be here to bring them together to, again, first, connect that community. And I think that is critical because community is everything.
Absolutely.
And so actually the Amputee Coalition started with the concept of community, focusing on peer support. And that really was the concept of paying it forward. People who had already suffered limb loss and understanding that challenge and make it on that new journey, they realized in order to feel like they really are thriving, they had to reach back and help others who are starting that journey. And so that really is the concept of our peer support program. And that, again, is all focused on building a community.
Absolutely. So any questions from any of our FIRE interns so far? I know we have a couple other targeted topics to go into, but any questions in general about the National Amputee Coalition? Some of you all were there when we first connected with them at APHA during our poster presentation. You might want to kind of, you know, bring the audience up to speed. I see Taishay, and then Tomas, you had your hand up too? Go ahead. Taishay, then Tomas.
So I'm only ask one of my many questions that I've been writing down. But one of my questions is like, do you guys ever like face a struggle? Like, do you sometimes like feel like there's people out to get you, or they like kind of judge you because you want to help people with limb loss?
So yes, I think there are often times that people don't understand the real, I want to say the real life of someone living with limb loss and why it's important to support them on that journey. And so, you know, I can't say that we have people who try to, you know, be a barrier to the work, but sometimes they don't truly get it. But then that's okay, because that's why I work here at the Amputee Community Coalition.
Help them get it.
Yeah,
I'm gonna help you get it right. See, that's what she's gonna do.
And oftentimes they, you know, really it's because they haven't heard the story, right? People's stories change perspectives. And so that is one of the beautiful things that I have the opportunity to lead at the Amputee Coalition, is to collect the stories of people in their daily life and all the things that they go through and they struggle, but yet they overcome. And in the end, those stories are very inspiring. And these are people of all ages, you know, young people, older people, middle-aged people. And so when you hear those stories, that changes, again, it changes perspectives and encourages people, even without limb loss, to see that no matter what they're facing in life, they can still overcome. And so we do have a young person from our YEP program who's going to share more of her stories. So I'll allow her to do that. But that's just that is natural, right? When people aren't used to seeing other people, you know, in other conditions or different than them, sometimes they aren't able to connect. And so that is actually one of the critical roles of the Amputee Coalition, is to build that bridge and to make those connections.
Thank you so much. Tomas, you had a question?
Yes, sir, Dr. Key. Well, first and foremost, I just wanted to thank you, ma'am, for taking the time to not only be here with us in this space, but just dedicate your life to this really humbling and rewarding work, for sure. It really inspires me. And I know I know I'm not thinking of going into like a medical field, but I know public health is everything, as Asia stated. But you're making me want to get more in that direction because it's really heartfelt and impactful. So I just wanted to thank you and also commend your organization too. That's very interesting how you said you all collaborated with the hospitals here in America, and how, you know, individuals are given a packet or information if they do experience this tragedy. So I really wish other people would adopt this model. as far as addressing public health crises here in America. Like on our last show, we were discussing long COVID. So I wish the coalition would do something similar to that. If there is a way that we could, take note of each other's models to really spread this message of public health, because ultimately everyone's here for the people. So I just wanted to congratulate you all for that. And additionally, my one question for you was, how can us as allies of the limb loss community, what role can we serve to help you out? What can we do? Because me personally, I have family members who have suffered, and diabetes and alcoholism has run rampant through my family. People have lost fingers and toes and even legs. And I just wanted to know, because that personally impacts me as well. I wanted to know, what can we do to help out?
So thank you, Thomas. Tomas. Yeah. Thank you. And so you said a lot. And so first I want to address that you're absolutely right. There are intersections in many ways. And I think the more partnerships and ways that we find the intersection to connect is how we grow the reach impact for people who fall within that broader umbrella of public health. I think what you asked is a very compact question, because people are in different places on their journey. In some cases, people were victim to an actual tragic experience that someone inflicted on them, and they suffered limb loss. Some, as you mentioned, are they're in that condition because of bad choices, right? And so either way, it's really kind of understanding where that person is with their mental and emotional health, and you mentioned that a little earlier. And I think that's where it's good to really first plug in, right? To plug in to say, hey, no matter why you're here, kind of sometimes it's a matter of forgiveness and letting go and overcoming that hurt that may put that person in that condition, and help them look forward to a brighter place, right? And so I think, first it is around mental emotional support, right? And then once that person can cross that bridge, then there's the message of knowledge is power, right? And again, that is where the Amputee Coalition comes in through our National Limb Loss Resource Center and all of the services and resources and publications that we provide. And so that knowledge then creates empowerment for them now to move into a place where they can decide the life that they want to live, because now they know all their options. They know what's possible. They know, what they have access to. And then it's a matter of taking action to move into that space and taking advantage of all those opportunities.
And I love that you said that, because one of the definitions that we as the Flint Public Health Youth Academy utilize is from the World Health Organization, is that health is more than just the absence of illness and disease, right? And so you can not have a disease and not have an illness, but still be unhealthy. So when we say health, we mean physical, emotional, psychological, social health, financial health. I mean, it's multifaceted. And I like how you talk about the need, because when a person maybe just had an issue or circumstance where they just had an amputation, there's a lot of psychological and mental stress and trauma that's happening. And I love the fact that you start there with understanding that. And so we, just for the sake of time, and again, we're just excited because this partnership is a wonderful thing, but we wanted to also, I know we have a young person here.
Okay, so you want me
I'm gonna go in the middle.
Okay.
I'm gonna go in the middle. We have a young person here. And again, y'all out there in social media land now, we normally have a couple thousand viewers every show. We want you to know that some of our young people that you see on these screens are here in the hotel, but we couldn't get all in the same room and get on the same picture. So I got them spread it out across the hotel on their own thing. So want to introduce yourself and tell us who you are, where you're from.
Hello, everyone. My name is Divine. I am originally from Nigeria, but I live in Texas. I am a junior writer for YEP. I am so excited to be a part of this program. Last year, I got to be a part of the youth camp and the national conference, and since then, I have grown exponentially. So I am so excited for everything that's gonna happen.
So, and we're so excited to have you. So we're the Flint Public Health Youth Academy, and we introduce youth really across the country, but more so in Flint and Genesee County, to careers in public health medicine and research, right? Mm-hmm. Living through the water crisis, we had a lot of national news media put a sentence of doom and gloom on Flint youth because they were exposed to lead. And we were like, no, just because we've been exposed, that doesn't mean it's a sentence of doom and gloom. We're going to flip it and let it catapult us into the next generation of public health professionals, medical professionals and researchers. And so we've done a lot of work around elevating youth voice. And so we've done several health messaging campaigns. So one, as a young person that's dealing with limb loss, right? Mm-hmm. How has it been, one, coping with COVID and this whole experience? And then we're going to go to one other question after that, but how has it been coping with COVID?
So I had my amputation the year before COVID, April 2019. When COVID came, it was devastating because I didn't have the support I needed. Mm-hmm. I just went through an amputation, mm-hmm. and that community I needed wasn't there. All the opportunities, most organizations kind of closed their doors because, I mean, COVID was a devastating thing. Mm-hmm. So.
Nope, that's okay. So what was it like living with that? So having the amputation right before this, so you're dealing with all the mental, psycho, social issues of having the amputation. And then now you're dealing with the social isolation and not being able to even, engage with people on a regular. How were you able to adjust to that?
I mean, for us, we kind of had like classes on Zoom. Mm-hmm. And prior to my amputation, I didn't really go out in the first place. So like being in a situation where I couldn't relate with anyone, mm-hmm. after the restrictions on COVID came down a little bit, I felt like I needed to meet with people. Like I felt like I needed to do things, to be around people. So COVID really changed my mindset on a lot of things, especially like the social interactions we need as people. Mm-hmm. So yeah.
Awesome. And then I have another question. So one of the other campaigns that we're doing this year is around gun violence and mass shootings. Mm-hmm. Unfortunately, when I was growing up, and I'm not that much older than you all, but mm-hmm. we had fire drills and tornado drills in school. Now you guys have to also have active shooter drills, mm-hmm. right? So just the thought that this is a reality that's becoming normalized, that probably shouldn't become normalized. What does that mean for a young person with limb loss when it comes to those types of drills? Because there may be limitations that you have to deal with, or, barriers that you have to deal with that other youth may not. And so when school officials are creating these, these responses and these procedures, what should they take into consideration?
I think the biggest part for me, considering like school shootings and projects, is that I am vulnerable. I am especially vulnerable because of my disability. I can't move as fast as everyone, and being in crowded spaces with a lot of people, it sets me up for failure. So I think one thing to take into consideration when having these drills is that like I need the extra support. I can't do it the way everybody else can. Mm-hmm. I need the extra support. I need the extra notice. And then another thing would be having, like bigger spaces in schools, mm-hmm. because I need the space to move. Like a fire drill alone is a lot of work, even though there's a lot of planning and consideration that goes into it, it's still a lot of work because at the end of the day, it's so crowding, and I feel like I will fall. Mm-hmm. I feel like I'm gonna fall. I feel like I can't do this. And then being in the community I am in, I actually have people around me who take that into consideration. Mm-hmm. There have been times where there were fire drills and I was on my wheelchair. And that's already difficult alone in like the small hallways. Mm-hmm. So I actually have people offer to push me, offer to help me. And that is so relieving to see. Mm-hmm. So, yeah.
Thank you for sharing that. Okay. And so we're going to have a comment also from the programming perspective.
So I actually would like to approach this a little differently, mm-hmm. around how our amputee youth can be best supported around mass shootings in schools. What I want to say is, living with limb loss requires more intentionality, right? The movement, just how you go through your day is already more thought out, right, than the average person. And so essentially, you know, amputee youth are positioned to actually lead those protocols because of the mental strength that they must already have in their daily practice and life anyway, right? And so I actually like to turn this around instead of it being a deficit, but more of as an asset, right? Because then they already understand, you know, some of the what you call protocols or the things that are already required, and they're more cognizant of those things than the average person, right? And so I think really, I think them being more the kind of the leader and particularly of how to mentally navigate those circumstances can be really more of how they can be part of that type of experience in planning for schools. Awesome. Yes, I wanted to share that there's a different perspective rather than just a deficit.
Right. And I think, you know, in the field of public health, first of all, minority and female youth in particular, we see less going into like medicine, research, and public health. And we think about other marginalized populations, you know, limb loss youth is a marginalized population that does not necessarily have the type of supports everywhere that it needs. I think there are some areas where it's really good and people are really intentional in, you know, in your words, but then I think that there are some places where people don't think, you know, and it's not. And so it's good to hear you say that it is not just a deficit, but it's also an asset, and especially in places where there is education around limb loss and really the intentionality to make sure that that voice and that perspective is included at the table when the decisions and the policies and the procedures are being created. And that's what's important. And that's why we're here, because we want to inspire more youth with limb loss to go into public health. They need to be at these tables where health decisions and policymakers are sitting. They need to be conducting the studies because they have a different perspective. They have a different understanding of things, and every voice needs to be had. So we have one other young person in the room. So I'm walking around the room, y'all. And I just want you to, first of all, I'm Dr. Kent Key, and we're the Flint Public Health Youth Academy. And as you can see, we have folk here, and there's probably about 4,000 people watching on YouTube and on Facebook or so. But I want you to just introduce yourself, tell us who you are, and why this group, this luncheon, why the Amputee Coalition is important to you.
I'm Henry Orton, and like I've been in my whole life without like a leg, so I was born without my femur and my fibula. And it's very important because like there's all the people here, they're it's like I'm not known as different. There's other people that are like me and then can understand me and like my struggles, because everybody's like almost the same. And it just like it helps a lot, like can mentally, like, because you can get like down sometimes when like you're like you feel different, maybe you can't do as many things, but like when you're here with everybody else, you can do everything, and everybody can do everything, and so it helps a lot.
All right, that is awesome. And so again, you all, as we're winding our time down, this is an awesome experience for those of you all who have never considered getting involved with the Amputee Coalition or just with the limb loss community. Take the time out. Many of us have different places in our local homes. I know in Flint, we have the Disability Network. We have so many groups that could connect us to really look at what does this mean when we say that we want to empower young people and create spaces and platforms for their voice to be heard, and for not only that, their concerns to be amplified, right? And so again, we want to also have probably Dr. Strider, you want to come and say something and represent? Come on over here. She's the lady that linked us and got us over here. I know, but I just want you to show your face because I've been talking about you. And so this is Dr. Strider, and she has been the one making it happen for us.
Yeah.
She got us here from Flint down here.
Yes.
And,
Hello, everyone.
And you can also do a pitch for what's coming up in July.
Oh, in August.
In August,
yeah.
That's right.
So, you know what, thank you guys for tuning in. We actually met Dr. Key from one of our coworkers, Trinea, at a conference. And I had just stepped out in the hall and told Camise, that's my sidekick, she does everything for us in our department, that this has been the most awesomeness and a blessed partnership with the Flint Public Health Youth Academy. It is important to us as my other coworker here, Jerica Thurman, and then our youth. Henry, we have favorites, but we don't like to tell everybody, but don't share that now. And Divine, it is beyond my imagination what we plan to do for this organization when it comes to our youth. It is the next generation. They are all of them, I tell them all the time, they're awesome and they are remarkable, they are smart. And it is our job to make sure we open doors for them. And then building a relationship with you guys is really another part of what we see as an opportunity to grow everyone's thinking process around supporting them, because they are brilliant. They just need the access. They need the doors open. And that's really why we are here. And so the next 2 days, today and tomorrow, is all about empowering them. And then in August, it's 4 days of just empowering them, just really bringing in some great speakers and activities. I don't want to tell all the secrets because then, Henry and Divine know everything. But it will be in Orlando. But I thank you all for all your support and your interest, and really want to support us in what we have planned for our youth living with limb loss and limb difference. They're great people. We love them, and they know that. We show it all the time. And we want to continue doing that with your support. So thank you guys again.
So those of you from Fire, you can stay right there. Those of you from Fire, if you want to share kind of your reaction when we first met representatives from this organization at APHA, and just the talk about wanting to partner and then actually getting the invitation. How did that make you all feel as these youth ambassadors who've been doing this work, really knocking down doors and creating platforms nationally for youth to have a voice in public health? And we know our motto is public health is everything and everything is public health. So how does that make you all feel as it relates to one, building the partnership, and then allowing this to be another platform to expand the work that we're doing with FIRE and the National Coalition, Amputee Coalition? Go ahead, Everett.
Tashay put her hand up before me, so I'm gonna let her.
I'm sorry, I didn't see that, Tashay. I couldn't see it.
No, it's okay. I forgot we have the little app things. So
yeah, I didn't see it. Go ahead.
When I first heard about it and got to know about it, I was at the APHA. I was excited. I was really oh my gosh, I got to tell my best friend, because I have a best friend who I've known her for I think 12 years now, and she's a prosthetic leg amputee as well, and she's got a lot of she needs a lot of help too sometimes, but most of the time she likes to be independent. And I wanted to because I was wondering what would her point of view be on this? And I'm like, oh my gosh, we're actually going to be doing this. And so as soon as I heard we were going to be able to partner up with you guys and visit, I was like, I'm going, I'm definitely going. So that's nice. And I also get to learn a lot too, and hear from other people as well, not just from one person. And I'm excited.
And Tashay is also studying sign language interpretation as well.
Good.
All right, Everett, go ahead.
Like Tashay said, I was just overjoyed when I found out. I personally wasn't there when the connection was made because just APHA was so busy, but I was overjoyed because we talk about making connections and we talk about supporting, and the intertwining of our two organizations is just showing that, we are actually able to make a change and allow for our messages to be sent out and reach a large amount of people, because education is important. It's extremely important. And I'm so excited that we're here and that I get to meet and fellowship and spread the word.
Awesome. Anyone else? Cole? Cruz. I'm sorry, I see Cruz. I'm sorry.
I wasn't the person who made a direct connection, but I got to watch it. I got to watch premiere. And it was so cool to see, you never know who you're talking to, especially at conferences like that. But to watch him give his full energy, and then for something to come out of it this, impactful like this, was really cool. And it was exciting because in a lot of these conferences or moments like this, People might suggest, oh, we're interested, we like to interact and things like that, but not actually follow through. But in this case, from that moment on, it was like, all right, let's figure out how we can get this thing done. And so it's really cool. I keep using the word cool, but that's what comes to mind. But it's really powerful to see how people want to support youth voices and how they're giving platform. I mean, that's a lot of what we wanted to do when we created, or not we, when Dr. Key created FIA. But that was a lot of what our goal was, and to see that there is being done in different communities and different spaces across the country was really important. And to know that it's really possible to make this more synergized and to connect these different communities. All you have to do is just try to make the commitment.
Awesome. And I know Cruz was referencing Amir, who has exams today, so he couldn't be on the talk show, but he was the one that actually engages, how you say her name? Trinea in the conversation and sharing the work that we have been doing. And our Youth Academy, you know, we're doing national presentations at national science meetings. We're publishing, we're doing a lot of stuff. And we are also looking to elevate and to lift other youth organizations that are doing awesome work. And so for us, this was like, yes, we can take them along for the ride, and whatever doors we go in, we can talk about this as a partnership. And so we're looking forward to actually submitting an abstract before March 30th. That's in what, how many days? In 20 days, right? To APHA, so that we can present in Atlanta. Go ahead, Asia.
Okay, so I wasn't at APHA, I was at work, and I work at a hospital. So that's part of my, don't mind me, I get a little bit overwhelmed sometimes. So working at the hospital, I see a lot of stuff every day. I don't walk in the room and somebody that passed away on me. I don't walk in the room and I didn't know how to react to what they was doing. But I done seen more amputees than I have ever seen working in the hospital, than I ever seen like walking the streets. I didn't even know that Flint had amputee, like an amputee community. I'd never seen one besides working at the hospital. But partnerships were the vision for FIA in the beginning, was to partner with different youth organizations, bringing everybody's voice to the front of the table. So seeing that come into fruition from the first cohort, I know Everett feel me, I know Amir and Cruz feel me. It's amazing. Like we've been working for 4 years to get to this point right here, and we got so much work still to go. So we appreciate y'all for coming along for the ride, and thinking of us as y'all catalysts for the ride.
Yes.
Awesome.
Yeah.
This is just the beauty of partnership.
Yes. Yes.
Yeah. All right. So again, we thank everybody out there in social media land. We'll tell y'all more about what we did at the next talk show. You know, again, we're every other Friday at the same time, same place. And if you miss us live on Facebook, you can always also go to our YouTube page at FIA 810 on YouTube. That's FPHYA 810 on YouTube channel. Again, we thank you for tuning in to a youth perspective. I am Dr. Key. We are the Flint Public Health. And remember, public health is everything, and everything is public health. Have a wonderful evening, everyone. All right. Bye, everyone.